Hello, everyone. Good morning. I see some of you putting your name, role, and organization in the chat. Thank you very much. We like to see who's joining us today. And we'll give it about one more minute before we get started. Also, a reminder, could you please mute yourself just as we're getting started, and later we'll have time for questions. Okay, great. We got some more people joining. Thank you all. We're going to go ahead and get started. We have a lot of content today. So we'll be moving at a pretty good pace. We will leave time for questions after we kind of cover our main content, but also please feel free to ask us questions through the chat throughout the training, and we will try to address those. Okay, Meg, I think we're ready to get started.
Yeah, 1 second. It seems to have frozen. Let's see. Is it moving for you now?
Yes.
Okay, perfect.
Okay, thanks. So welcome to our training, everyone. My name is Megan Rooney. I'm from Health Literacy Media. And Meg Watkins is also here, and she's helping with the slides today. She'll also be a co-presenter. And we're from Health Literacy Media, HLM for short. And we're working with the Kansas City Health Department to develop a series of workshops, as well as health materials for you, covering topics around clear communication and focusing more on COVID and vaccine communication, but this can apply to any health, excuse me, any health communication. I'm the Director of Creative Programming, and I'm joined by Meg. As I mentioned, she's the Health Literacy Science Program Manager. And we are a communications group out of St. Louis. We specialize in helping people communicate clearly about health. So as I mentioned, we'd love to hear your thoughts and questions throughout. So please feel free to use the chat, and we'll be keeping an eye on that. So here's what we'll cover today. We want to give you some concrete skills for how to better communicate with your clients, your patients, the people, the communities you work in. We'll be focusing on COVID, but as I said, these apply to any health communication. So research shows us that as public health allies, you can build health literacy and become a trusted messenger.
Sorry, no, the computer that was in the background. Yeah, sorry. It just started, yeah.
Okay, I'm gonna ask if everyone can mute themselves as we're getting started. Okay, so research shows that we can become trusted health messengers by using these 3 strategies that we mentioned here on the slide: motivational interviewing, how to counter misinformation, and the teach back method. So if you attended our first trainings, you might remember these health literacy definitions.
I think that's what's taking me so long, you know. I don't know, just think.
Okay, sorry about that. Personal health literacy, there's also organizational health literacy. So personal is the degree to which individuals have the ability to find, understand, and use health information and services to make decisions. But on the other side of the relationship, organizations have a responsibility to equitably enable individuals to find information and make decisions for themselves. So what does health literacy in verbal communication look like? That's what we'll be covering today. In the past, we've covered health literacy in written materials. Today is all about speaking with your clients and your communities. It could be a doctor recommending a booster shot. It could be a community health worker teaching patients about the vaccine schedules. It could be a school nurse reminding kids to wear their masks while indoors. Or it could be a non-English speaking patient calling to schedule a COVID-19 test. But there are many reasons why our information doesn't get to our listeners. It could be a literacy issue. It could be that the information is too complex. It's not communicated the way that that listener learns. It could be stress. It could be a medical mistrust issue. It could even be strong political and social beliefs, which we have seen during this COVID pandemic. So there's many reasons why we have these communication breakdowns. And breakdowns happen when the speaker does not say what they mean or say it clearly. The listener does not hear it correctly, or the listener misinterprets what is said. So we'd love to hear from you right now. And we'll do this throughout the training. We'll ask you to share with us your thoughts. So think through any communication breakdowns that you've had in your work, whether it's with coworkers or with communities, and please type in any barriers or patterns that you see. So what topics are hard to communicate about? Are there certain communities that you struggle to communicate with? We'd love to hear that, so I'm going to leave a minute in the chat for you to add those. Okay, so we have keeping doctor's appointments, so helping people make their appointment and then actually attend them, remember, and then have the skills to get there. Latino community communication. Okay, so cultural communication issues. You know, how does this specific community learn best? What are their beliefs? How can I communicate with them, understanding all these things? That's good. Language barriers, especially over the phone. Yes, definitely. Generational. So yeah, how do we speak with an older community? How do we speak with a younger community? How is it different? Many of my patients are from rural areas, limited education. It can be difficult to explain instructions. Great. So the teach back method, which we'll cover at the end of our training, is a great tool for helping people understand instructions. Age appropriate communication strategies. So these strategies are covering mostly adults. So young adults, these, you know, you could tweak these for a younger audience like children, but these aren't specifically designed for children. So, but that's a good thing to keep in mind. Virtual communication. So how we're using virtual tools, how we're being clear over telehealth, videos, phone. Okay. Succinctly and clearly explaining the why behind activities I'm asking people to do. That's really good. Yeah, that's really good. So these are all really great, great thoughts about where these breakdowns happen. What are your struggles? We hope that what we're covering today can help with some of these. I don't know that they can cover everything because I'm having lots of ideas about, like specifically Emily wrote about the why behind activities. We don't specifically cover that, but you know, hopefully we can think creatively and some of these skills will apply or will help you think more about that. Patients not understanding how to manage their chronic disease. So teach back is a method that might help with that. Okay, so a lot of just health education, chronic disease, generational and cultural issues. Okay, great. Thanks for sharing that. What we're going to start with today is motivational interviewing. And so I didn't hear a lot of you mention vaccine communication specifically, getting their blood work done. Okay. But this really works for any time someone is kind of on the fence about a decision. And that really applies to the COVID pandemic and when people are choosing to get a vaccine or to do certain activities, what's safe, what's not. That's what this tool can be helpful for. So motivational interviewing is a collaborative conversation to strengthen a person's own motivation and commitment to change. It's an evidence-based strategy to help people make health behaviors and choices. For example, getting vaccinated, stopping smoking, using drugs, could also work for, not attending doctor appointments or possibly not taking steps to manage their chronic disease. This can be tweaked for those situations. I'm reading Jennifer's comment. Also remember, okay, so this is about, okay, thanks, Jennifer, and we'll respond to you at the end of the training. So this is a way to build a stronger relationship, and the WHO actually recommends that all people providing immunizations and healthcare providers be trained in MI. So here's a little graphic. Oh, that's okay, Jennifer. Here's a little graphic that we created to help you remember all the pieces we'll cover today on motivational interviewing. And some of you may know a lot about this, but the 4 OARs, O-A-R-S, are open-ended questions, affirmations, reflections, and summary statements. So that's what we'll cover in this section of the training. Under the boat, you see this kind of water. It's our little symbol for water. These are 3 things that you always want to be thinking about as you're using these skills. So assessing stage of change, we will get to that in a minute. Looking for any ambivalence, where are people not sure about their behavior, their choice, their decision, where might you be able to get in and work with them a little bit? And then also taking a non-judgmental stance, always, not judging their choice and their decision, but helping motivate them towards a healthier choice. So before we get into MI, I want to cover, I want to kind of set it up and cover what the research is showing right now about the groups of people regarding vaccines. So I'm also curious how you all feel about this, if this is something that you have come across in your work. So research shows there's kind of these 3 groups. So one group is the logistical barriers. So this is people who have time and transportation barriers. They might worry about costs. They're unsure. They might need more information, but they're kind of on the fence. The wait and see group is also on the fence. They might be waiting until there's more data out, more information. They might not trust the medical system. They might feel like this is an experiment. They don't want to be experimented on. They want someone else to step up first, and then they'll see. Then they might make a decision. Lastly, there's this hard no group, which, if any of you are doing vaccine outreach, vaccine communication, I'm sure you have come across this or heard about people like this, but these are the people that say, no, absolutely not. I'm not doing these things that you're recommending I do. This could be for political, ideological reasons, religious reasons. There's a lot of misinformation and conspiracy beliefs out there. This group tends to not like to be told what to do. Arguing with them, giving them lots of information can actually make it worse. It can backfire. So I want to know, just off the top of your head, how do you feel about what the research shows here? Is this what you find in your work, whether it's with vaccines or with other health conditions? Rebecca says yes. When it comes to vaccines, I get the hard no group a lot. I'm getting some yeses in the chat. Okay. A lot of people are agreeing with this. Okay. Well, I'm glad that matches up with your experience. We're taught to honor and respect their decisions, right? Which can be frustrating, right? If you're a public health worker, you're a doctor, you're a nurse, you're someone who believes in health, wants people to be healthy, it can be frustrating. So before we get into those MI skills, let's talk a little bit about stages of change. And a lot of you with health backgrounds will have heard of this. So you want to think about how ready is this person to make this choice. So there's 5 steps in stages of change, and it helps us understand how ready someone is. And here are some examples of what people might say in these different groups. So in pre-contemplation, someone might say, no way, I'm not getting the vaccine. That's that kind of hard no group. Contemplation might be, well, I'm worried about dying from it. My friends didn't get side effects, but I'm not there yet. I'm not getting it yet. Preparation are people that are preparing. Maybe I'll talk to my doctor. Maybe I will. I'm busy. Maybe if I get a day off, I'll do that. So kind of preparing for the step. Action are people who are going to do it. So I called, made my appointment. I've made my decision. I went to my appointment. And then maintenance are people that are on board from the beginning. I got my vaccines, got my boosters. I'm ready for whatever else is needed. I wear a mask. I'm doing everything that my doctors and everyone says I should do. So these are these kind of categories of people. And so it's really helpful in public health behavior, because as you're talking to someone, you can be thinking about, what stage do I think they're in? Are they on this lower end? Or are they already doing this? Do I need to spend my time with this person? So the bottom 2 that just turned kind of green, this is where MI can be really helpful. MI short for motivational interviewing. This is where there's ambivalence. This is where people are maybe on the fence, but you also might come across hard no groups in that pre-contemplation, and that's where sometimes you do your best. There's really not much. Research is showing more and more. There's really not much we can do to convince them, except be a listener, provide information. Okay, Meg, we can go to the next one. Okay, so let's get into it. A lot of the time we try to share information with people who haven't made up their mind or have chosen not to make their choice. But when people are scared, angry, don't trust, giving them information usually doesn't work. It can cause defensiveness, and it can quickly shut down a conversation if we're just like, here. Well, here's information you should know. I have a handout on this. So being really thoughtful about when people are ready. In motivational interviewing, you're trying to build a bridge. So you're looking for any ambivalence about their behavior. Are they showing that there's a part of them that is just has not made up their mind fully yet? You also want to ask about what they value, what's important to you. Your family, your health, your work. And then you want to look for the discrepancy between what they value and the choices they're making. So, for example, if someone refuses the vaccine, and I've heard some of you are working with these kind of hard no groups, but they say they really love to go to like concerts or go to plays. They're bummed that concert venues are requiring vaccination. Well, that's a place you might explore. How is their choice holding them back from the stuff they love? What are some other things they could do to get to their activities that they love and feel really good about that? So that's kind of MI theoretically. Oh, sorry, I forgot about the slide. So a few examples of ambivalence. So what might this ambivalence sound like? So it could be, I know that not getting, Meg, you can click again and the quote will come up. I know that not getting vaccinated means I could get sick. Okay, there's a little bit of ambivalence there. I'm going to ask one more time. So I'm trying to mute people as I can see there's some noise coming in. But again, just a reminder, please mute yourself. Someone's making a comment to me that there's a lot of noise. Thanks. Okay. The next, Meg, you can keep clicking. So you also might hear someone say, well, I'm worried about spreading COVID. They're not vaccinated, but I do worry about it. Okay, well, there's ambivalence there. Intent to change. It seems like it's just too soon for the vaccine. maybe I'll just wait. Little bit of ambivalence there. They had not made up their mind. And then something like a positive statement, I think I'll probably end up getting vaccinated, but I'm not ready. So these are all places where people are on the fence. You can use these skills to kind of move them a little bit. You know, the goal is just to help move people a little forward. The goal is not get everybody vaccinated. That's a huge lofty goal. Okay. Now let's look at what MI might actually look like in conversation, and then we're going to get to the skills. So a lot of setting this up. Meg and I are going to read this conversation between a client and a provider.
I don't know about this vaccine. I'm worried about it.
Okay, so you feel worried. It sounds like you care a lot about your health. Tell me more about what you're worried about, your worries.
I've heard this vaccine isn't safe for people with allergies.
Oh, I see you have allergies. So tell me, on a scale of 1 to 10, how likely are you to get a COVID vaccine? 1 being never, 10 being, yes, I want it today.
I'd say a 3 or 4 because I had a peanut allergy when I was younger.
Aha, I understand. So you're worried that your allergies will act up with the COVID vaccine, is that right?
Yes.
Okay. Are you up to date on all your other vaccines?
Yes.
Okay. And did you have any allergic reactions to those?
No.
Okay, well, that's really good. So you know that you can get vaccines safely, but you just are not sure about this one. Okay, so that's a conversation, and then it would go on, you know, to explore the client's ambivalence there. So we're going to go through and just explain a little bit about what the provider was doing, the skills that the provider is using in this conversation. So in this first line, the provider validates the feelings and then reflects on what they value. They care about their health. And then they ask an open-ended statement, tell me more. Here, the provider used a scaled question, and this is a nice way to assess their stage of change. So a 3 or 4 might put this patient, if you think back to the 5 stages, might put this client in that pre-contemplation, contemplation stage where MI might be helpful. And then they ask kind of a summary question, and they ask for the client to tell them if that was true. Here, they're trying to find a place, they're looking for that ambivalence. So they find a little discrepancy that the person does believe in vaccines in general, but just not this one. So now the provider states the ambivalence and then can go on to explore it. Well, why not this one? What have you heard? What questions might you have? What's different about this vaccine to you than your other vaccines? Sometimes just bringing this discrepancy up to people can help them think through it more and think, well, I guess, you know, this isn't really logical, and allow you an opening to share more information. So you can see how this might help someone find their own internal motivation, which is why it's called motivational interviewing. You'll also notice here how the provider takes a very non-judgmental stance and uses a lot of affirmations. I understand, that's good, I see, that can help them feel heard. And I'm sure a lot of you use these skills. And then a quick note about MI, these conversations don't always go perfectly, you know. You're just trying them out. You're just trying to practice and use some of these skills. You do the best you can, and you know, and practice really will help you get better and feel confident about when to use which skill. So finally, let's get into the skills. We're going to go over these OARs, the OARS. So the first one is open-ended questions. A lot of you probably know these are questions you can't answer with a yes or a no. Closed-ended questions will say, you know, did you eat breakfast today? Yes or no. Open-ended would be, what did you have for breakfast? And the closed-ended can really stop a conversation. So instead of, do you want more information? You might say, what information can I share with you? Instead of, do you think you could do more if you were vaccinated? Yes. Well, how about tell me about the things you'd be able to do if you were vaccinated? That gets people talking more. Some other ways to start an open-ended question: how can I help you? Help me understand. Where did you learn that? How would you like things to be different? Where could you go for support? What things would you look forward to? What do you want to do next? Tell me more about that. These are all ways to help people talk, help get them talking. So on this one, we're going to do a quick little quiz. I'm going to pull up a quiz. Hopefully you can all see this pop up in your Zoom app. And this is going to show you 5 different questions, and you're going to choose whether it's open-ended or close-ended. So I'll give you a minute to fill this out. If you can't see this, your Zoom might not be fully up to date. So I will share the answers at the end. Okay, I see some answers coming in. I'll let it go for a couple more seconds. Okay, see it slowing down. So I am going to, oh, it's moving. I want to give you all a chance. Okay, I'm going to end the poll. I'm going to share the results with you. So we'll go over these quickly. Number 1 is, oh, here you go. You should be able to see the answers. Do you think you will change your mind about getting vaccinated? That is a close-ended question. Do you think you'll change your mind? Yes or no. You know, that's allowing someone to just give you a one-word answer, and then you don't have an opening to talk more about that unless you ask a different question. What concerns do you have about the vaccine for kids? That's an open-ended question. What concerns? They're going to tell you all about their worries and their concerns. They can't say yes or no to that. Number 3, on a scale of 1 to 10, how important is that to you and why? That's open-ended. So it's close-ended in that they're going to give you a number, but then if you add that question why, then they're going to elaborate on that. Number 4, why do you believe that? That's open-ended. They're going to explain why. They're not just going to say yes or no. And number 5, do you believe the COVID vaccine is safe for children? Yeah, most of you got that one. That's close-ended. A yes or a no. Okay, great. So those are a little tricky, but a really great tool. So the next letter is A for affirmation. These kind of come natural to us, so I'm sure a lot of you use these. These are just like nice statements that can make people feel good, make them feel heard. And it helps kind of any tension that might be there in the conversation. It helps put people at ease. So you're just affirming what they're saying with empathy, respect, and support. So here are some examples. I appreciate you talking about this with me. That's a great question. I can really tell how much you love your child. I get it. I understand where you're coming from. You know, if they're talking about their religion, you can just say, God is really important to you. You're affirming what they're saying. You're making them feel heard. So here's a little example in a conversation with a mom who might be hesitant to have her daughter vaccinated. So no, I don't think I want my daughter to get vaccinated. I heard it means she can't have babies when she's older. And here's some ways you can validate her feelings. Well, thanks for sharing your feelings on this, because it is hard to share your feelings in this culture of, of this heavy discussion around vaccines. I get it. I have a daughter too. We do worry about our children. Or you could say, I can see you've been thinking about this, just any way to make them feel that it's okay for them to speak. They're not being judged. And that's going to open up more conversation for you. Moving on to the third letter of ORS is reflections. This can be a little more complicated. We're going to try and keep it more simple for you, but this involves listening to a person and then not asking a question right away, but making a statement that's a reasonable guess at what the meaning is under their words. So it sounds kind of complicated, but really you're listening and then you're trying to make a statement that confirms how they're feeling or what they really mean. So here are some statements that might help you get started with the reflection. So you feel like, it sounds like you're wondering if, so what I'm hearing you say is, and then you're going to describe your interpretation of their thoughts or even their underlying feelings. So say someone is kind of spouting off all these reasons they're not going to take this health behavior. They're worried about all these things. They're not sure. Your reflection could just be, you feel so overwhelmed with all of this information. Just trying to really get at how do they feel? And these are deeper reflections. So you're not using their words so much, but you're kind of reading between the lines. So this can really help someone feel heard. I'm sure you've all had that situation, either as the speaker or the listener, where someone kind of summarizes and explains back to you how you feel, and you go, yes, exactly. That's it. That's how I feel. That's what you're trying to do here with reflections. And this can help you also understand their perspective more and move you to your next piece of your conversation. So here's an example with that same mom who's not sure about vaccinations. Here's how reflections might work. So the first one might be, you kind of just repeat what you're hearing. You don't think you want this vaccine for your daughter. That's not a very deep reflection. You're just kind of repeating her words back to her. This statement is getting at the underlying ambivalence. You're still thinking through the risks and the benefits. Because she says, I don't think I want my daughter to get vaccinated, means she's thinking about it. So really listening to the words people are using. So you're still thinking about it, you're worried, but you think maybe it could protect her. And then you see how the mom reacts to that. Lastly, you can just reflect on how they're feeling. Well, it sounds like you're really worried. That tells me how much you care about your daughter. This last one is really the deepest form of a reflection. You can also point out gently how someone looks, how it looks like they feel. You could say, I see tears in your eyes. You're really, really emotional about this issue. You could say, I see a lot of worry on your face. Tell me about that. You could say, I see that you're uncomfortable when we're talking about this. What makes you uncomfortable? So kind of pointing out the emotions in the room is also a different type of reflection that can open it up, help people feel heard, and really hopefully move you, further in the conversation, not just shutting it down. So things that shut it down are asking yes or no questions, coming with judgment, which I'm sure all of you do not do or really try not to do. But these are the things that can make people feel like they want to just shut down. And so the point of these are to open people up, make them feel heard. You're really trying to get them to think through their decisions and share information, move them a step towards a behavior. The last letter is summaries. And so it stands for summaries. These are just statements that we use naturally, again, like affirmations. This is that you can use this throughout a conversation or at the end of a conversation, just to summarize what you've heard. Let me see if I understand X, Y, Z. Here's what I've heard you say. Is this right? Here's what we've covered. We're going to now switch to another topic. It can also help you switch if you need to move on. This is, you also, not all the time, but when you can, ask, did I miss anything there? Did I get that right? Anything you want to add? So it's just another way to kind of close up a conversation by helping people feel involved and heard. So here's another example with the same mom. Some summaries might be, I'm hearing you're concerned about your daughter's ability to have kids in the future because you've heard the vaccine may affect this. anything you want to add? And then hopefully she'll say, yes, that's right. That's what I've read about. And then you can either move on or dig further deep into this topic. So that's a lot of information. We're going to definitely leave time for a discussion of this, but we do want to cover this one next topic in section 3 about countering misinformation. And this is based on new research coming out about how to have conversations with people who believe conspiracy theories, believe misinformation, believe things that are not true. It's really hard to address this. And so we're going to cover that, and then we're going to leave time for discussion. So hang on just a little bit more. And Meg, take it away.
Thanks, Megan. So as Megan mentioned, we're going to talk through how to counter misinformation, which can be a really helpful tool when having these vaccine conversations. So there's 5 steps to countering or debunking misinformation. And we've all heard some of the common myths and misinformation that are around about COVID and vaccines. So we're really curious in knowing and learning from you all if you've encountered this misinformation and what are the common myths you hear. So if you could take a second and type them into the chat. And Megan, if you don't mind, I cannot see the chat in my presentation mode. So if you could share those as they come in.
Taylor says that the vaccine will cause infertility. Eric says it will kill me. Microplastics in the vaccine. Just another way the government is trying to control us. Unsafe for pregnant women. Absolutely. We've heard all of these too. They want to track me. Young people who have had the vaccines are dying. Unsafe for breastfeeding, cause heart problems in the future. Putting a chip in you, can't breastfeed my child, inject me with COVID and I'll get sick anyway. Wow.
Thank you all for sharing. And so this is a really clear example of how there's a lot of misinformation and fear around the vaccines. So we're going to cover 5 steps to counter or debunk this misinformation. So first, as we learned a few minutes ago, addressing the underlying emotion can help show empathy and build a more trusting relationship with the person that you're talking with. So validating the feelings under the words is really important. Then you'll lead with a fact. So it's important to provide a factual alternative to the misinformation. After that, repeating the false information only once is helpful because it reminds people of what information they should revise. So you don't want to repeat it too many times, otherwise that information will start to appear true. So give a warning that you're going to restate the misinformation and then repeat it only once. And then explain why the misinformation is false and name any possible hidden motives or misleading tactics. And this helps switch out the truth for the myth that they had heard. And then 5 is end with the fact again and make this the last thing that they hear. So it's the last thing that they will process in the conversation. So you can think of this as a truth sandwich, which will be the truth. And then the meat of the sandwich is explaining the untruth and then close it up with a nice truth again. So let's see this in action. So the misinformation here is the vaccine is too new and was rushed, so it can't be safe. A provider may respond with, I understand that feeling. It is amazing that scientists were able to get us these vaccines when we needed them. So this is validating the feelings that are under the words. Next, leading with a fact. The truth is they're very safe. And then giving a warning and restating the misinformation once.
Okay. Did you need a psycho assistance or anything? Well, sorry.
Can you make sure you're muted as we're going through? Thank you. So giving a warning and then restating the misinformation only once. There's a lot of false information out there, like that they were rushed. And then the fourth step, explaining why the misinformation is false and naming any possible hidden motives or misleading tactics. But these types of vaccines, called mRNA vaccines, are not new. They've been studied since the early 1990s. Plus, the vaccines were thoroughly studied and reviewed by medical experts. And then ending the conversation with another truth. So, America's leading experts agree that they're safe. We suggest also having a few basic talking points from credible sources of information, like the Kansas City Health Department or the CDC's COVID webpage, prepared ahead of time. This also helps eliminate our own hidden biases that can really reduce our emotions during tense discussions. So having those sources ready with some key facts and tips as you go through can be very helpful. So now you've learned some of these tips for using motivational interviewing. Let's check back in on this conversation. So Megan and I will go through this again, as Megan will be the provider and I will be the client, and we'll revisit this conversation earlier.
Well, that's good. So you know that you can get vaccines safely, but you aren't sure about this one.
Yeah, I guess that's true. No vaccine has ever hurt me, but I've heard that a lot of people have serious side effects, like they stop breathing and die.
I can understand why you might worry about your allergies. The truth is, serious side effects are not common. They are very rare. There is a myth that serious side effects happen a lot. But out of 1 million people, only around 11 will have a serious side effect. You'd be more likely to have a severe reaction from a bee sting than the COVID vaccine. So those serious side effects are very rare.
Oh, I didn't know it was that rare, but I'm still not sure.
Well, that's okay. You don't have to get it today. Now that we've talked it over, tell me where you are now. On a scale of 1 to 10, how likely are you to get the COVID vaccine?
I might be closer to a 4 or a 5 now. I'm still not ready, but I think I need to learn more before I decide.
Okay, so you're doing your research. So we've discussed that you're concerned about your allergies because of what you've heard, but you're still interested in learning more. What information might be helpful?
Okay. So here you can see this line that is highlighted in kind of the teal green. And so what is the provider doing here? They're reflecting on feelings that might be in the underlying words, and they're giving a truth sandwich. So they're doing, they're validating the feelings and then giving a truth, addressing the misinformation, and giving another truth. And then here, later in the conversation, they're affirming and asking an open-ended question with a scaling question. And then this last line here, they are affirming and making a summary statement and leaving the conversation where we left it with an open-ended question.
After you pass this drive to the church, something will say private drive, and just turn in there.
And one note about this conversation is that these skills really work best with people who show any amount of ambivalence about their choices, as we talked about earlier. There will be some people who have just made up their mind, and there's a lot of evidence in the field that you can't do much about these folks. So really, it comes down to just doing your best and providing information in an empathetic and best way you can. So we've covered almost all of our content, including motivational interviewing and countering misinformation, but we'd really like to leave some time now for you all to ask any questions, share any ideas or experiences you have, or thoughts you have about the skills we've just gone through, or any challenges you face and you're wondering how you can address them. So feel free to use the chat or to unmute yourself and add anything to the conversation that you would like.
Rebecca asked, any data on the vaccine and long COVID? So are you asking if we know of any updated data on if the vaccine protects from long COVID? If that's your question, Rebecca, if it exacerbates it. Oh, okay. So do we have any data on if the vaccine exacerbates long COVID? That's something that we would have to look up. So, something that the health department probably has data on or knows sources about to find that information. It's a little out of the scope of what we covered today, but if anyone else has any resources or ideas about that, feel free to chime in.
Help under the need, or say family lack support, lack of family support, like family lack.
Anyone else have any specific questions around the skills that we taught today? Using motivational interviewing, have any of you tried it before? Do you think that these skills would work for you, given the audiences, the clients, the communities that you work in?
Yes, I believe that it'll work for where we are at the community healthcare or total healthcare. We come across a lot of them. Their main concerns is, just like you said, is them coming in and what they hear out on the street, and they don't want to get their baby sick. But we try to express to them that even though that you're concerned about your child, you have to also be concerned about you too first, and then make sure that your child is okay in the process. Because without you, your child still is not going to do anything better or have anything going on if you're not here with them. So we try to basically let them see that on both ends. And I like the way y'all did the role play, because that's exactly how it be when we sitting there talking to them about them. And the first thing they come up with is, I can't do it because I don't know how it's going to be, and it might affect my other things that's going on with me. And the first thing I ask them is, basically, you doing other things that might could affect what's going on with you. So what's makes that any different? I had talked to one, he was alcoholic, then he had substance abuse. I'm like, you don't sit there and question where they get that alcohol from or what's in that alcohol, and you don't question what you getting out on the streets and what they putting in there, but you're going to question one thing that you don't even know nothing about the other stuff that you're putting inside your body. I said, can you explain that to me? Because I would like to learn and try to understand that part.
That's great. That's motivational interviewing right there, what you just explained. So you're already doing it. So you found ambivalence, or a discrepancy between what they do now and this thought they have about this vaccine. What's the difference? Explain that to me. That's awesome. It's exactly the skills.
And so basically that's where by me are their peer. So basically, I know sometimes the nurses and the doctors, they only can state certain professional ways of talking and stuff. Well, what I do is I'm like their liaison. I'm the middle person. I don't have to talk that way to you. I talk
Right.
to you direct. So you
Right.
can understand, and so you can so I can help you understand more clearly. They
Right.
going to use words and things that you might don't understand, and then you sitting there like, I don't have time for this, and then you start getting irritated. So that's when I come in. I want to talk to you just like I'm talking to you, so you can understand where we're coming from.
Exactly. So you've got the relationship. You're building the relationship as someone in the community, not as someone, up in the medical building that just
Yeah.
speaks down to them.
Yes, and that's,
Yeah.
I believe also that's a cause of problem with them dealing with the vaccine. A lot of them, they speaking in terms that they don't understand and they get pushed forth because they don't understand it. So they get irritated, which my thing is that's when I talk to them, I let them know, you sitting here telling me that you don't want it because you heard this, you heard that, but you wake up in the morning every day doing the same thing that you don't even know what you're getting anyway. So what's the difference to me? So explain that to me.
Exactly. That's great. And so you're also listening for their barriers, it sounds like. So you're listening to, they're saying that people use these words I don't understand, I get irritated. That's a barrier. So you're helping them think through those barriers to their health decisions. Yeah.
And I let them know I'm here for them and we can look at it and we can go through it together. I told them I had mine. I got my shots. I got all three of them. And I'm still sitting here talking to you. So how you going, do you see any limbs fell off? I surely ain't grow another leg or another arm. So I surely don't have no eye, no extra eye in my ear. So I want to explain. So to explain to me what you trying to tell me. Explain to me.
Exactly. Where's your evidence?
Yeah.
Yeah. That's
I said,
great.
we all have side effects on a lot of stuff. I said, you still going out doing what you're doing. So what's the difference? I'm still trying to figure out what's the difference. We got to talk about this difference.
Yeah, the discrepancy. Exactly.
Yeah.
I think everybody needs you to just come talk to their clients because, that's what people are
Well,
saying.
I'm here.
People in the comments are saying you're you're my new favorite person.
Yeah.
So that's awesome. So, also something underpinning everything you're saying is like your relationship is key.
Yes.
You build trust by being yourself and by speaking just, like a normal person and a caring person.
Yes.
And that can get you so far. That can get you really far into the conversation.
Yes. And then a lot of them like, well, you gonna be there? I'm like, well, I might not be there, but I can come for you. I come for you. Show up, I show up.
Yeah. You follow through. You follow through. Yeah, that's trust, right? You got to build that trust. That's huge.
I tell them, I said, you don't show up, that's when I come looking for you.
You don't want me looking for you.
You don't want me pull up. I tell them my pull up game strong.
That's awesome. Yeah. And using humor too, right? Like,
Yes.
yeah.
That's why they be looking. They be like, Miss Angie, wait, you gonna be there when I get there? I'm like, I'm gonna be right there waiting for you.
Absolutely. That's
And that's
awesome.
how we end up getting a lot of them in and like you say, break the barrier down to let them know it's okay. I'm like, I'm still here talking to you. So the things that you're talking about, this gonna happen. That I'm like, I've thought about it, but I'm like, I still have health issues that I need to make sure I'm okay on both ends. So I don't have time to sit there and think about where this leg gonna fall off. We'll find out when somebody sew it back together. I'm like, we're gonna be okay.
Yeah. Right. I love it. I love your approach, and you're using all these skills. It's like it's natural to you in your work.
Yeah, it is.
Yeah. Well, thanks for sharing that.
You're welcome.
Okay, a lot of people are agreeing with you. They're saying they learned from you. So maybe Tanya must work with you. So she says I learned from Jelia daily. Okay. Also, I want to mention that someone shared the CDC website link in the chat. So Rebecca, this could help get at your question from earlier about data. I know that the CDC site is very updated and they do provide research articles and try and back up all of their points with research. So that could be a great place for you to start. Thanks for sharing that. And I think we have one more short technique to teach in the last 5 minutes.
Yeah, so we're going to do a quick refresher and talk through the teach back method. And this will go kind of quickly with our last couple of minutes here, but you will all receive the slides and a one-pager that will have this information on it too. So to help you better communicate about facts that might be confusing, the teach back method works well to really help clear up any misunderstandings. So we at HLM absolutely love the teach back method because it builds in checkpoints to make sure that your clients are actually understanding what you're saying along the way. So teach back works great when you're teaching new information that might involve several steps, like how long to quarantine after exposure to COVID or when to get your booster shot. So here's how teach back works. First, you would explain a new concept. Next, you'll ask the person to explain the concept back to you in their own words. As they explain, you'll assess whether they fully understand. And if they do, you move on to the next concept. If they have an incorrect interpretation or are missing information, then explain it again. And this time use different words or a visual to help you explain. Then ask the person to explain it again and assess their response, and so on and so on. So you can repeat the cycle as many times as you need. It is important to note that you are not testing them. What you are testing is yourself and you, and if you are doing a good job explaining the information to them. So we'll go through a really quick example of this. So here, it might be a little small, I apologize, but the provider could say, thanks for coming in for your COVID test today. With your symptoms and the fact that you're not up to date on your vaccines, we should be careful. So here are a few things I need for you to do. You will need to stay home, called quarantine, for 5 days. If you live with anyone else, try to stay 6 feet away from them or in a different room, which means isolate. If you need to be around anyone else in your home, wear a mask. And if after 5 days you don't have symptoms, you can end your quarantine, but be sure you wear a mask when you're around others for 10 days. And the client could respond, okay, I think I get it. Provider could say, that was a lot of information. I want to make sure I clearly explained what you need to do next. So please tell me, how long do you need to quarantine? They may respond saying, 5 days, and then I should be symptom-free and I can get back to work and things. At this point, the provider would say, sorry, I wasn't very clear. Let me tell you more about quarantine and when it's safe to go back to your normal routine. So important note again here is to make it clear that if they are misunderstanding, that is not on them, that is on you as the person who's explaining the information. And again, you're not testing them. It's not, a quiz of their knowledge of what you have explained to them. It's about whether you're doing a good job explaining. So at this point, the provider could then re-explain the information using different words. So that was a really quick overview of Teach Back, but it kind of ties back into the other skills that we've gone through today. So we wanted to be sure to mention it. So these last slides have a couple of resources for you all. These will also be on the one-pager you'll be sent. But with that, we want to open it up to any final questions in our last couple minutes. And as a reminder, we will be having another seminar at the end of March, and this will be on Vaccines 101. So how to talk to people about vaccines at a very basic level. So how they work and the importance of them and how they work with your body. So opening up to any questions before we close out.
I don't see any questions in the chat, Meg. I just see people are thanking us for the training. Right after this training ends, it should take you to your browser for a quick survey. We would love it if you filled out the survey. And then you'll also be receiving a handout that summarizes these tips with some examples, just as a reminder for you, so that you can get those extra doses of the information, keeping it by your desk or with you as you do your work. I'm not seeing any more questions, and we are at time. So I think we can probably end it right there.
Thank you all for joining and for all your work.
Yeah, thank you for everything you're doing out there. Important work.
And thank y'all for the training. I appreciate it and it helped me out a lot.
Great. Thanks for your thoughts.
You're welcome. Anytime.
And making us laugh.
Well, I appreciate that.
Yeah.
Joyful heart, joyful laugh.